Haematuria is the passage of blood in the urine, and it may be microscopic or macroscopic, intermittent or continuous. A pattern of blood in the urine may be initial, terminal, or flank, or total. The blood in urine is a serious symptom and must always be fully investigated, especially to exclude cancer. Certain drugs and food products may color urine red, resulting in false hematuria, and these should be differentiated from true hematuria, which is detected by microscopic examination of the urine. Examples of such substances are rifampicin and rhodamin B, food coloring used in cakes, cookies, and soft drinks. So occasionally, vaginal bleeding may be mistaken for hematuria. Definitive treatment depends on the cause. The causes are glomerulonephritis. So glomerulonephritis usually presents with dysmorphic red blood cells in the urine or red blood cell cast with proteinuria. The non-glomerular, like urethra, trauma, infections, bladder infection, stone, bladder cancer, varices, BPH, prostate cancer drug reaction, and cyclophosphamide, radiation cystitis, parasite infestation, as hematobium, cystosomal hematobium. Also from urethra, as infection, stone, and tumor, and from the kidney, infection, and pyelonephritis, stone, anatomic anomalies, polycystic kidney disease, AV fistula, renal vein or artery thrombosis, neoplasms, renal cell carcinoma, as well as Wilms tumor, trauma, sickle cell disease, benign prostatic hyperplasia, carcinoma of prostate, bladder and kidney, urinary tract infection, urinary calculi. So medical causes like sickle cell disease, acute glomerulonephritis, and anticoagulant therapy. The symptoms are fever, and fever suggests infections. For example, pyelonephritis, cystitis, and prostatitis. And also colicky flank pain suggests urinary stones associated lower urinary tract symptoms. And this suggests bladder or prostatic cause. And blood in the urine is on initiation mixed with the urine or at the end of passing urine. So pain or discomfort on passing urine, usually associated with infection, calculi, or trauma. And also painless intermittent hematuria associated with cancers, for example, bladder and kidney cancers, and lower urinary tract symptoms, and also loin pain. So the signs that are usually elicited are pallor, abdominal masses, for example, kidney, bladder, and low or suprapubic tenderness from urinary tract infections or calculus. So investigations are FBC and sickling status, HbA electrophoresis if sickling test is positive, blood urea, electrolytes and creatinine, urinalysis, urine culture and sensitivity, abdominal and pelvic ultrasound. The main treatment objectives are to treat underlying cause, to arrest bleeding. Non-pharmacological treatment, high fluid intake is advised in order to prevent clot formation in the urinary bladder. And if patient presents with clot retention, then catheterize and refer. Pharmacological treatment for urinary cystosomiasis, you give praziquantel oral, and for urinary tract infections, you treat with the appropriate antibiotics. Referral criteria, so refer all other cases as well as those with persistent hematuria for appropriate investigations and treatment.